Andrew Buer and Dr. Mario Ramirez of Opportunity Labs. Welcome to Living Corporate. How are y'all doing, man?
Good, doing well. It's great to see you again, Zach.
Thanks for having us, Zach. Good to see you, man.
Hey, it's always a pleasure. Listen, I want to get right to it because we're here for a good time, not necessarily a long time. Let's start with the big picture, right? What sparked the idea for creating a tool focused on specifically opioid overdose prevention in K through 12 schools? We can talk about Opportunity Labs as a whole. I just want to get to the meat of it, right? Because we're here to talk about this incredible one of its kind tool. Let's talk about Opportunity Labs, but then I really want to talk about why this particular focus.
Yeah, well, I think it's probably best to go back actually to what Opportunity Labs is first, and then talk about why we focused on opioids. Opportunity Labs is a national nonprofit that was founded in 2019, and I think we exist because we believe that all kids deserve an equal opportunity, and our work is really heavily focused on K through 12 education. As part of that, I think we realized that there was this nexus between health and education in a way that others hadn't explored. And the dashboard that you guys helped us build is an extension of that work. Andrew, what would you add to that?
Well, first I would say, Zach, it's always fun when you bring Drake in to the equation to start a podcast. I think some of this work is a direct response to what we heard from communities, right? We've done a significant amount of work over the course of the last year, really focused on youth mental health. And as we were out there talking to adults that are closest to kids, we heard again and again about the challenges associated with opioid use disorder. And some of the really, really tragic incidents that were happening when kids took pills that were laced with fentanyl. So in many ways, this work was really a response to what we heard as a need coming from communities across the country.
To that point, can you speak to the urgency of the crisis and what gaps you saw in the existing data and response infrastructure, right? Obviously, you did not think about building this tool for fun, and you didn't, there's obviously some type of calculus that went into it. Can we talk a little bit about that?
Yeah, absolutely, Zach. I think a lot of your listeners, if not every listener, have probably been touched by the opioid epidemic in some form or fashion. I think what we've seen over the last now going on 30 to 35 years is that this epidemic has really sort of morphed and changed in a few different ways. And if we go back to when things really started in the early 90s, the epidemic grew out of a prescription drug abuse situation and was primarily focused in, parts of Appalachia and rural America. And then, 10 years later into the 2000s sort of became more of a heroin epidemic as access to prescription opioids tapered off. And we thought we were making progress, really until the 2010s when fentanyl really moved into the American, sort of way of life. And as fentanyl spread throughout a number of different channels, we've seen that the populations affected have really spread beyond just, sort of lower socioeconomic groups, both, away from really rural America. And now it impacts big cities and small cities alike. We've seen that fentanyl has come in from, overseas sources, and it's made its way into counterfeit pills. It's made its way into the marijuana supply. And so as a result, we've seen overdoses really become something that you hear about much more frequently. And over the last, decade, I think just a couple of stats that your listeners may not be kind of immediately familiar with, but part of what I think drove this dashboard was the fact that, overdose deaths have increased by almost 110% from 2019 to 2021 in young kids aged 10 to 19. Fentanyl deaths also surged by almost 200% in that same period and were heavily linked to counterfeit pills. And in 2022 alone, fentanyl overdose was the third cause of death behind traffic accidents and firearm injuries in kids in that same age group. So this has really become a growing problem that lives again at that nexus between healthcare and education, which is where we work, and part of what drove our focus in this space.
That's incredible. And I want to talk about opportunity, continue to talk about Opportunity Labs. We've been alluding to this tool. We're going to make sure we put that link in the show notes for those who want to learn more about it, and also put the press release there, as well as the case study from Living Corporate. But let's talk about this tool that you built and what makes it so unique and first of its kind. Because I saw that language in the press release. Obviously, I agree with it, but I'm curious to get your perspective as to what makes it so.
Yeah, well, I think what's novel about it, Zach, is, over the course of the last decade, in response to the challenges that Mario just outlined, states have started to take action to their credit and put together a set of laws and regulations and policy guidance to help all different kind of community-based institutions respond to this crisis, and that includes school districts and schools. But no one had sort of mapped that set of actions with any real rigor or in a way that felt really, really intuitive to a user. And we thought that would be the foundation to begin to scaffold potential answers to questions like, does a really comprehensive set of laws, regulations, and guidance end up preventing more of the kind of incidents that Mario just outlined? And so in some ways, this is a foundation that we hope a lot of academics and researchers, districts and schools, policymakers can begin to think about scaffolding additional work on top of. But that was sort of like the fundamental thing that was new about this data product. Mario, anything else you would add?
No, I mean, I think the other thing that we really found, and we've seen this with some of our other work around COVID and around, sort of thriving youth in general and healthy schools, was that there's often this gap that exists between, sort of what we would traditionally call health professionals and education professionals. And, sort of COVID brought that into starker relief, right? We realized that these groups often speak different languages. Sometimes they don't necessarily understand what's, of primary importance to the other. And we saw how that led to some real breakdowns, in COVID. And I think the goal with this dashboard, was to hopefully create some of that common language and a shared data set that people from those two groups could look at comparatively and hopefully come to the same conclusions and hopefully come up with some, shared policy solutions, that address the epidemic like Andrew was talking about.
And Opportunity Labs is not exclusively an organization that builds tools, right? Like, you're really about driving sustainable, equity-centered solutions. And so how does it, I know, and Mario, you spoke to this at the top of our conversation, but how does this project really reflect your commitment in that regard?
Well, I think Opportunity Labs is a great organization. Andrew and I co-founded the organization in 2019, and my background is more sort of on the clinical side. I'm an emergency medicine doctor by training, and Andrew, I'll let him talk about his background in education. But one of the things that I think we really discovered again with COVID and in some of our other work, was that public health, and particularly trust in public health, has been heavily impacted by data and the way that people perceive data over the last couple of years. And, our belief was that for all of the intellectual rigor and the policy solutions that we can, sort of bring up in this space, we needed a partner who could help us create this visually in a way that was, alive and tactile and interactive for the audience. Because one of the things I think we've learned coming out of COVID is that your audience has to be able to see and interact with your data before they're going to believe it. And, for as much as hard evidence exists that this is a real problem and there are potential solutions out there, we, I think, needed to create that and frame that in a way that the audience could better understand. Andrew, what would you add?
Yeah, I mean, I think big picture, Zach, is like we want all kids to thrive, right? And so any constraints to kids thriving are issues we care about, right? Whether that's kids with incarcerated parents, kids that are encountering challenges with opioid use disorder, kids that are trying to navigate challenges associated with, early grade literacy or numeracy or academic self-efficacy. We're sort of agnostic, right, in terms of the specific challenge, but we are generally thinking about challenges that constrain kids thriving. And so this just felt like such a universal issue for communities across the country, blue states, red states, cities, rural areas, suburban areas. Like, it doesn't really matter. Zip code is sort of irrelevant here. And those are the kind of problems that we like to take on because they have the potential for so much impact. And look, we know that we are standing on the shoulders of tons of incredible organizations that have been focusing on this issue for years. And we also know that districts and schools are being asked to do so much these days, right? They've been, in the course of the last 5 years, epidemiologists. They've been mental health counselors and therapists, right? And I'm talking about like almost everybody that works in a school. And you could add a number of job descriptions to the incredible work that school-based folks already do. But with all that recognition, we also thought that sort of elevating this conversation might create space or at least surface area to think about what's really working in terms of prevention and response and where there are opportunities to do more.
To that end, like, in what ways are you hoping that this tool impacts policy conversations around student health and school readiness and parent empowerment? Like, how do you see this practically fitting into that?
Well, I think one thing that, often comes up in policy circles, Zach, right, is this question of do regulations and policies actually lead to the outcome that you're hoping for when they're written, right? And I think when we did this sort of 50-state landscape of the regulatory, sort of guidance and policy that exists out there, it's actually very different across the states. There are some states where it is specifically codified that a school needs to have naloxone, which is a opioid antidote, sort of on site. There are other states where that's not specifically codified. There are other states where it's very clear about who has the authority to give that medication and under what circumstances and whether like any indemnification for that person exists. And then there's others where, that guidance really doesn't exist. And then there's even other states where the guidance doesn't necessarily come from the state, but it might come from the Department of Education or it might come from the Department of Health. And so one of the questions coming out of all of that is, what is the ideal framework that leads to the best outcome for kids and makes, sort of education both as safe and as productive as possible? And so our hope, I think, with this tool is that whether you're, a policymaker or you're an educator or you're a parent or you're a student, you can go to this site and you can do a comparative analysis of, one state to another. You can easily look and see what regulations and policies exist. And then you can compare that to what the data looks like in your state. And out of that, I think we're hoping to tease out, what are the best practices across these states that have, better outcomes than others, and figure out how we can help put policies in place that, like I said, hopefully make the school setting as safe and as productive as possible. Andrew, what would you add to that?
Yeah, I mean, the only thing I would add is, we are, Zach, concurrently doing a national survey of school nurses related to this issue because we think that they are sort of the adult that is primarily responsible for responding to this incident in schools. And so we'll see what that data bears out. But I think like one thing that is already clear is that to Mario's point, there is massive variation across the states. There is massive variation within states in terms of how districts and schools are responding to this crisis. And so one thing we hope that this work does is just sort of elevate and amplify the conversation around this challenge, to Mario's point, so that we can sort of start to learn about what is working in terms of laws, regulations, and policy guidance that is being implemented at the hyper local level. I also think like there is a really important research opportunity here, right? That hopefully this tool contributes to, right? Research funding is going away, or at least changing in a lot of really important ways in this moment. And I think, to continue to focus on this issue, which again cuts across society in so many ways, is not something that we sort of intentionally were thinking about, but I think actually is pretty meaningful at this moment.
So maybe the last thing I would add there, Zach, and I know you've met several of the other members of our team. Andrew and I are here, representing the larger Opportunity Labs team. And, that we include a number of like data scientists and community health folks on our team that were really instrumental in this process. And I think, are an important part of the analysis that is going to go into this. And one of the things that I think we try to do at Opportunity Labs is, really make sure, like I said, that we're sharing information across silos, and our team is a key part of that.
Yeah. I want to name this also about Opportunity Labs and our experience in working with you all. That one, it's one of the most diverse teams that Living Corporate's ever engaged. And then also one of the most collaborative in terms of seeking understanding across. It kind of reminds me of, I don't know if either one of you are Star Trek fans, but I think like Star Trek is like one of like the quintessential examples of like teamwork and like leadership in action, because it's just, these are like wildly different. These are different species, right? Let alone people. But they figure out ways to like collaborate and work together, right? And I saw that in real time with Opportunity Labs, and I think it is a beautiful thing to see a team like that develop and deliver the outcomes that you all are. So 100% agreed that you all are representing a great number behind you that are working and also working alongside you to do incredible work. Now, look, if I'm an educator or a policymaker and I'm listening to this conversation, what is the action? Like, what should I go do coming out of this discussion?
You want to jump in, Mario? I'm happy. I have some ideas.
Yeah, go for it.
Yeah, look, I think the first thing is look at the data for your state and start to think about what it looks like relative to actual incidents, right? Both overdose and death incidents, right? Because I think ultimately what you want to build to is a deeper understanding of how the legal, regulatory, policy guidance is actually impacting outcomes. And so I think that's the first step. And then I think the second step is, or maybe the sort of second set of thinking is really going to be related to what knowledge exists around these laws, regulations, and sets of policy guidance, right? Do teachers know that they have a responsibility? If they do have a responsibility, do school nurses know if they have a responsibility? Do they know whether their training is funded? Do they know if their district has provided opportunities for training, right? Like there are all of these sort of open questions that I think policymakers, and let's just put policymakers in quotes, because we could be talking about, school boards, we could be talking about district superintendents, we could be talking about state education agencies or elected officials, right? I think there is this really important conversation around just access to knowledge and awareness related to role and responsibility in response to these incidents on school campuses. Mario, what else would you add?
Yeah, I think Andrew's making the great point, right? That I think Opportunity Labs' work is about creating sustainability, and in this day that we're living in now, access to information is about creating sustainability. And so, I think the first thing that we hope people do is go to the website and take a look and see what this tool is that we're talking about. It lives at schoolopioidsafety.org. But our hope is that, everybody goes to check that out. And that includes teachers, parents, students, who can equip themselves with the knowledge to have an informed discussion with their school boards and with, local leaders who make things like purchasing decisions around the naloxone and figure out how they're going to create sustainable financing mechanisms. Because we know that these tools make a big difference. And we know that things like naloxone are really leading to improvements in survival and preventing opioid, overdose deaths. We've seen that data from CDC here in the last year. But it's not a foregone conclusion. Pushing this envelope forward means that people have to stay engaged, and they've got to stay engaged with information behind them. And that's our hope.
This has been a fire conversation. I appreciate you both. And I want to say again, living corporate historically on our podcast, we'll feature Black and brown leaders. We'll feature folks on the margins. We'll feature all types of folks, right? Activists, elected officials, educators, entrepreneurs, executives, authors. The list goes on. What I really appreciate about this conversation is that we were able to have a really, really great discussion about not only the work that Opportunity Labs is doing, but also the point of intersection that Living Corporate was able to just be a part of the story. And so thank you both, not only for being on Living Corporate, but for allowing us to support you all in the really critical work that you're doing that impacts everybody, right? Like I have a 5-year-old, I have a 2.5-year-old, I got 2 newborn twins. They're going to be going through the public school system. I have siblings who just got out of the public school system. I have nieces and nephews who are also, everybody is impacted by this. And even if you don't have any children, you belong to a community of where children exist and are a part of public school. And so it does, in fact, impact everybody. And I just want to say thank you both for being on the podcast. And again, thank you for allowing us to work with you.
Yeah, well, one thing that we didn't really talk about, Zach, was the role that Living Corporate played
Fair.
in helping make this possible. I think so. If we've got just a few minutes, I would like to talk about that for a second. I think when we decided that we were going to build this platform, this website, one of the things we realized was that it was a bigger technical challenge than we had realized. And it's tough to pull data from some like databases that are open source, others that aren't, formatted the same way. But also, I think to create something that's visually appealing, that's clean, that fits the need of the users, to sort of display and portray the message that we're trying to provide. And I think you and Mike did just a fantastic job helping to realize what we wanted to do at the Opportunity Lab side and help bring that to, reality. I know that we couldn't have done it without you guys. And you guys were a fantastic collaborative partner, and really listened to what I think we were trying to do. And I know I speak for the whole team when I, just express our gratitude to you guys for helping to make that happen.
Yeah, Zach, it was a pleasure working with you guys. And I had a mentor early on in my career who told me the best way to connect with folks is story, fact, story, right? Particularly when you're meeting new folks or trying to convince them of something, right? So start with a story, hit them with a fact, go back to that story. And I'm increasingly convinced that using interactive storytelling combined with data and analytics is a really, really good way to do that around challenging policy issues. And you allowed us to do that in a really seamless, aesthetically pleasing, intuitive way. So we are deeply appreciative, not only of the product that you help us build, but also just the more sort of, I think, macro perspective that telling stories with data is a really, really helpful way both to educate communities and inform them, but also to empower them with knowledge that they can act on. So we're deeply appreciative, Zach.
Hey, I appreciate y'all. I'm going to be turning purple on my own podcast. Dr. Mario Ramirez, Andrew Buer, Opportunity Lab. Check the link in the show notes. Till next time, y'all. Peace.
Appreciate you, man.
Thanks.